Andrea Flores, more businesses may be opening up, but COVID-19 is still top of mind for many of us. That's why every week we get your coronavirus questions answered during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Nida. Last week, an official from the World Health Organization implied coronavirus rarely spreads through asymptomatic people. The next day, the organization took a few steps back, saying it's still unknown. Dr. Dave, what is your reaction when you first heard about this?
Holy smokes, coronavirus is confusing enough, and then when you wind up having just more misinformation come in, especially from someone like the World Health Organization, it really does stir the pot in a bad way, very confusing. The World Health Organization basically said that the rate of transmission of coronavirus from people without symptoms is very, very rare. And that goes in contrast to what other organizations such as the CDC has to say. Now, the CDC has based their figures on more than 24 studies, and they found that about 35%, or about 1 in 3 cases of coronavirus, are spread through people without symptoms. And so you have these conflicting messages here. I know the World Health Organization then backtracked and tried to say things along the lines of, well, we were talking pre-symptomatic versus asymptomatic. We don't need to be thinking about that. We need to be thinking about the fact that we know that people without symptoms can spread coronavirus. They can infect us. So we need to continue to follow the things that we have been doing: physical distancing, masks, as well as good hygiene.
And many neighboring states like Arizona and Utah have seen an increase in coronavirus cases in the past week. Why do you think Colorado has not seen a similar spike?
Well, I think a lot of it has to do with how the states are handling reopening. I think Colorado as a state has done a very nice gradual and graduated return to reopening the state. And I think that people have done a really good job in terms of following the guidelines that have been put out by the state. Take a look at some of the surrounding states, places such as Arizona. They just declared a public health emergency because of the spike in cases that are going on down there. But when you look at Arizona, Arizona basically has no social distancing, no mask requirements. And even as of today, restaurants are allowed to open at full capacity. Such a contrast to what we've got in Colorado. When you look at Utah, they believe that had to do more with a lack of social distancing after Memorial Day and Mother's Day. And so, that is a specific reason there. New Mexico, a little bit less of a problem, but a concern nonetheless. Their rising cases has been pretty much confined to more localized, not statewide types of outbreaks. Another state to consider that's close to us is Texas. Texas has seen a huge rise in the number of cases over the last couple of weeks as they have reopened a little bit more quickly than our state has. So what does this mean for our state? Well, actually, for those of us here in Colorado, you think about the amount of travel that goes on between these states and us. We go there, they come here. You look at people coming into our state in order to enjoy the summer mountain tourism season. Look at the number of people who are traveling in and out through DIA. And so I think we do have some concerns, not so much of how we're handling it here in our state, but really what is going to be coming into our state.
And there is a lot of talk now about a second wave of coronavirus. Are you expecting there to be a second wave?
It's really kind of funny because a lot of folks are saying we don't even know if we're out of the quote first phase yet, or first wave yet. A wave is a very ill-defined thing. There's no set number when it comes to this is a wave and this is a wave and this is a wave. Take a look at Colorado. We maybe went through the peak of our first wave, so to speak, maybe back in April or so, when our case numbers were just, they were big. And then when you take a look at where we are right now, fortunately, the numbers have gone down. But take a look at 22 other states around the country. Their numbers are spiking. Are they still part of the so-called first wave, or are these isolated spikes? And we just don't know. I think that the big concern is how each of these states, with their reopenings, are going to affect other states. I think when it comes to what may be happening in Colorado, the thinking is we may see some isolated spikes, so to speak, through the summer and early fall. But, as kids wind up returning to schools, as businesses reopen, as the weather gets cooler, we're spending more time together inside. Maybe there will be a so-called second wave. But, the answer to this whole idea about waves and just number of cases going up, it is a million-dollar question. I don't think anybody has the answer to. We need to maintain our vigilance and do what we have been doing in order to keep our state safer.
Dr. Dave, thank you as always for joining us. We will see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just head to cbsdenver.com.